Hello, welcome to week 2 of your Spinal Decompression Rehabilitation program. I'm Dr. Andy Fetterman with RebuildDoc.com. Today's workout, we're only going to utilize an exercise band that I fixed to the pole here. You want to fix that to some kind of banister or railing or a support beam in your basement, but something that is fixated that you're able to pull the resistance at a level of about 2.5 feet off the ground, because you're going to be doing all these exercises either kneeling or on the ground. Our first maneuver has multiple variations. I'm going to give you a few. If you need more, you're more than welcome to reach out. The first maneuver we're going to do is called a plank. We're going to lay on our stomach, and what we're going to do is bring our elbows in. We're going to lift our upper body with while we're putting pressure into the elbows. And as this, we're going to go to more of a push-up position and keep our body flat as much as possible. Sometimes that's too hard, and we start here in a plank position and work our way down as we get stronger with the plank. If that's too difficult, we can also do this on our knees. We can also do this in a push-up full extended maneuver on our knees here, straight like so. You can go even higher using a chair or a step, where you can get to the point you're using less body weight as the resistance moves through the entire movement. The next movement we're going to do is called a Superman. We're going back onto our stomach. And what we're going to do, arms extended, we're going to lift our hands and our feet off the ground. We're going to just do this for 10 times. Same with the plank. We're going to do that for what is requested is 10 to 30 seconds for the planks. We're going to do 10 reps for the Supermans, just like so. It doesn't matter if we get all the way up or we only get a little off the ground. The whole point is to engage the posterior musculature to work on strengthening the low back. Our next maneuver is more in the yoga realm. It's called a pigeon pose. And with the pigeon pose, what we're going to do is work on opening up the hips. So with this maneuver, I usually go down almost that plank position. With my back legs, I take one leg straight, and with my other knee, I spin and sit back as much as I can into this position. And we'll do it on both sides so you can see it better on the camera. We come back up, drop back leg, we sit back, I spin my foot, and we bring this, and what we're trying to do is stretch through this hip and open up the hips. When we're able to have more mobility in the hips will allow us to have less pressure on our low back as we're doing these maneuvers. If you can only get to here, that's totally fine, or only here. The further down you can get, the more we're going to open up those hips, but this is one to keep working on. Our next move is going to be a knee to chest stretch. So how we're going to do that, we're going to now go on our back, and what we're going to do is we're taking one knee and we're pulling it towards our chest. With this, you're holding these for 10 to 30 seconds, just like you're doing with the pigeon pose, and for whatever else is on this workout for this week's sheet. So what we can do is I will also take this to vary it and kind of move the hip around as we're doing this stretch. And the reason we do this is that the hip is a ball and socket joint, so it moves in more than one direction, just up and down and out and back. So we'll pull, keep the other leg down. As you open the hip and move it around, you'll feel it stretch into the glutes and also into the groin as you move this leg around. Now, what we can do next is that we can take our band, we can take this, and what we're going to do is we're going to take the band here, around here, and it's going to engage the hip flexors, and we're going to stretch still like so. And we really want to get this down actually more towards the fold in the leg, because we want this to help pull that hip back and take this part that way so it opens and distracts this joint. A lot of the exercises that we're going to be utilizing through this spinal decompression program is about distraction and opening up and decompressing. So again, we're moving through these areas. If you do not feel enough stretch or tension, then we're going to add another band or use a thicker band to be able to get into that joint to feel the stretch and the pull and that distraction. Like so. You can either add a band or move further away because the band will get increased tension and will be able to give you more resistance. If you have any questions, feel free to reach out to us at relief@rebuilddoc.com. I hope you enjoy the workout.